This segment will review the openings from the pelvis to the lower limb and the vessels passing from the pelvis to the lower limb. We're now going to look at the openings from the pelvis to the lower limb so that we can describe the course of structures leaving the pelvis to make their way to the lower limb. You can see on this diagram that we have this opening here that is deep to the inguinal ligament. We have the obturator canal, and posteriorly here we have the greater and lesser sciatic foramina. What we're going to do with each of these openings is to consider the two regions that opening communicates between. We've talked quite a bit about spaces within the pelvis, particularly the true pelvis that we see down here and the false pelvis that lies more superiorly. External to the pelvis, we could consider regions of the thigh, so this might be the anterior thigh, or we could consider regions like the gluteal region posteriorly. And what we're going to do is to now use a three-dimensional pelvis to be able to turn it around and have a look at this idea in a bit more detail. You've seen diagrams of a number of the openings from the pelvis to the lower limb, and we can see a number of these openings here on this model. I'm going to get you to complete a task in a moment, which will be to think about the regions of the body that communicate via each opening. To assist you with that task, I'm going to go through that activity for one of the openings in particular. So we're going to turn this around posteriorly and have a look at this opening here that is the lesser sciatic foramen. So at the moment we can see that the pipe cleaner is through that opening and it communicates externally here with the gluteal region and inferiorly underneath the pelvis here with a region called the perineum. I'm now going to ask you to complete that activity for each of the other three openings. You can pause the video now. So by looking at the model, we've been able to determine the two regions that each of these openings will communicate between. And in a text version, this is what your answers should have looked like. As we saw, the lesser sciatic foramen, because it's below the pelvic floor, communicated between the perineum and the gluteal region. The greater sciatic foramen, because it's above the pelvic floor, it communicates between the true pelvis and the gluteal region and indirectly down into the posterior thigh. The anterior opening that's deep to the inguinal ligament communicated between the false pelvis because it was above the pelvic inlet and the anterior thigh externally, whereas the obturator canal that lies more medially communicates between the true pelvis because it's below the pelvic inlet and again with the medial thigh. We've reviewed the openings of the pelvis and we can now see the vessels that will make their way out through those openings from the pelvis to the lower limb. This is a mid-sagittal section of the pelvis, so we can see the sacrum posteriorly and the pubic symphysis anteriorly, and we can see some of the major arteries making their way down through those openings. The common iliac artery is making its way down into the pelvis and it divides into an external iliac that becomes the femoral artery and an internal iliac that gives off gluteal arteries and the obturator artery to the lower limb, but it also gives off a number of other branches that are supplying visceral organs of the pelvis, in this case for example the bladder. We're not particularly interested in those vessels, but we're mainly concentrating on the vessels that are making their way to the lower limb. If we look at a diagrammatic version of this, we can see that in fact the abdominal aorta, which wasn't visible on the previous diagram, branches into the right and left common iliac arteries. This diagram only shows the branching then of the left common iliac, but obviously there would be similar branching on the right hand side. This branching actually exemplifies the principle that we see down below here. That is, arteries and veins are continuous throughout their course, but tend to change names either in different regions or where they branch or receive tributaries respectively. So arteries would branch, veins would receive tributaries. So if we looked at the left common iliac artery, we can see that it changes name as it branches. So this is this example here of the application of that principle. The internal iliac, as we saw on the previous diagram, goes into the true pelvis, and the external iliac remained in the false pelvis. The internal iliac then branches further. It had those visceral branches that we weren't particularly interested in, but it also had the obturator and superior and inferior gluteal vessels that were making their way to the lower limb. Again, this is an example of changing name where they branch. However, if we looked at the external iliac, we can see that it continues as a continuous vessel, but changes name to the femoral artery. And this is an example of where a vessel changes its name in a different region. It's named as the external iliac while it's in the false pelvis, and as the femoral artery once it makes its way into the thigh, where the femur is the major bone. So we've now looked at the arteries making their way from the pelvis into the lower limb. I now want to consider the other vessels. If we looked at a diagram that included the veins, we'd see that it's almost an identical pattern. And typically, the veins will have the same name as the arteries that they run with. The only exception to this is that all of the veins eventually drain into, that is, they're tributaries of, the inferior vena cava that accompanies the abdominal aorta. If we looked at the lymphatics, these are typically described as running with the arteries because they're deep lymphatics, and there are numerous lymph nodes associated with those lymphatics as they make their way back up towards the heart. The next idea I want to consider is a principle related to describing the course of anatomical structures. Now, this is usually used for nerves and vessels, although it can be used for other structures, but there are three key aspects to it. When we're describing the course of a structure, we can talk about where it starts, that is its origin, where it ends, that is its termination, and how it gets there, that is what are its major relationships, using appropriate anatomical terminology, to other structures as it makes its way from its origin to its termination. I'm going to ask you to pause the video in a moment, but before I do that, let's consider the vessel in hand. So the example I want you to give relates to the external iliac vein, and the key to this is understanding the direction of blood flow. So I want you to describe the origin, the termination, and its major relationships. We've seen a diagram of a number of these vessels of the pelvis, and you can see a number of them on this diagram here, with the arteries shown in red and the veins shown in blue, and further vessels down here in the true pelvis. In a moment, I'm going to ask you to apply a principle related to the course of an anatomical structure, and the vessel I'm going to ask you to apply that to is the external iliac vein that we can see here that I'm pointing out. So if we apply this principle to describe the course of the external iliac vein, there were three key ideas: the origin, the termination, and the relationships on the way between those 2 points. Firstly, the origin is applying the principle that we've just seen previously. That is, a vessel will change name either where it's a tributary or it changes from one region to another. In this case, distal to the inguinal ligament, we had the femoral vein, but it changes name, that is, it's the origin of the external iliac vein once it continues from the femoral vein at that point proximal to the inguinal ligament. So this is an example of where a vessel changed name by travelling from one region to another. The termination is that it becomes a tributary of the common iliac vein, one of two tributaries. And again, this is an example of that same principle, where a vessel in this case changed name by becoming a tributary of another vessel. To understand its relationships between those 2 points, firstly we can consider that once we're proximal to the inguinal ligament, we talked previously about the fact that that opening deep to the inguinal ligament communicated with the false pelvis, so not surprisingly we could say that this vessel travels through the false pelvis. And as it does so, it's accompanying the artery with the same name, so the external iliac artery, and as we'll talk about a bit later on, it's also going to be accompanying the femoral nerve.